Welcome back to ACES Dental Quick Guides. Today we're going to be talking about perio cleanings. There are two types of perio cleanings that we do in a dental office. The first one, called prophylaxis, often called prophy, and the second is scaling and root planing, which is often used by the lay term of deep cleaning. Please note, we are no longer using the term deep cleaning at our offices. This is being done to avoid confusion and misunderstandings during treatment planning between our staff and our patients. So let's look at the difference between a prophy and between perioscaling. Prophy is the regular cleaning that is usually done on new patient exams and recall. Perioscaling, on the other hand, is usually diagnosed by the doctor and then done on a scheduled visit. Prophy typically doesn't require anesthesia. Perioscaling is done because there is presence of calculus and tartar under the gums. For the doctor to reach this area, the tooth will have to be anesthetized. Once the prophy and scaling has been completed, the assistant will polish and floss the teeth. The assistant is also responsible for providing oral hygiene instructions to the patient, both verbally and via email through Curve. If your patient needs a perioscaling, there are certain things that you need to be aware of. Many insurances will only allow the doctor to scale one quadrant per visit. This means the patient will have to come back for multiple visits if he wants the insurance to pay for the cleaning. The doctor may also decide to do one quadrant per visit because there is too much tartar or bleeding happening while the cleaning is being done. Some doctors do all the scaling and root planing in one visit. If this happens, then the next visit appointment would be a perio check or any other further treatment that the patient may need. Some doctors do scaling and root planing in sections. If that is the case, then in your next visit, please enter the quadrant which will be cleaned next. Please note, if a patient asks you, will all the cleaning be done in one visit? It is best to refer to the biller or the doctor to answer that question. This is a tray setup for a scaling and root planing appointment. Always check the pedal of the Cavitron and make sure there is water prior to the doctor coming into the operatory. A prophylaxis setup is similar but requires a new patient kit as well. Always, again, check the foot pedal of the room and make sure there is enough water for the doctor to use the Cavitron.